Hey friends, today we are going to revise oculomotor and trochlear nerve, that is the 3 and 4th nerve. Oculomotor nerve, third cranial nerve, purely motor, moves the eye in general, supplies most of the muscles of eye and plays an important role in accommodation of eye. Eringer-Westphal nuclear parasympathetic component 3, 4, 6, 12 GVE column yes, 3, 7, 9, 10 GVE column. Edinger-Westphal nucleus. Ptosis down and out pupil. PDO. Oculomotor nucleus somatic component. Cranial somatic efferent fibers. General visceral efferent. GVE 3, 7, 9, 10 and GSE 3, 4, 6, 12. Functional component general somatic efferent, that is the general somatic efferents GSE column, which contains 3, 4, 6 and 12. Supplies all extraocular muscles except lateral rectus and superior oblique. Since we know that lateral rectus is LR6 and superior oblique SO4. Okay, arises from somatic component. General visceral efferent 3, 7, 9, 10 supplies the sphincter pupillae and ciliaris muscle by ciliary ganglion. Arise general visceral efferent fiber GVE column 3, 7, 9, 10 supplies the sphincter pupillae and ciliaris muscle, arises from parasympathetic component, and the parasympathetic component are G, V, E column, those are 3, 7, 9 and 10. Okay. Oculomotor nucleus, Edinger-Westphal nucleus, oculomotor nerve, levator palpebrae superioris, superior rectus, medial rectus, inferior oblique, nerve of inferior oblique, ciliary ganglion, ciliary muscle, constrictor pupillae and dilator pupillae. Course, relation and distribution arises from oculomotor sulcus on medial aspect of cerebral peduncle of midbrain, runs forward and laterally between posterior cerebral and superior cerebellar arteries, pass through tentorial notch of tentorium cerebelli to reach middle cranial fossa. Oculomotor triangle, cavernous sinus, it divides into upper and lower divisions. Small upper division passes above optic nerve and longer interior lower division below optic nerve. Larger lower divisions divides into three parts. Superior rectus, levator palpebrae superioris, ciliary ganglion, lateral rectus, medial rectus, inferior oblique, lower division, superior orbital fissure, cavernous sinus, posterior clinoid process, posterior cerebral artery, superior cerebellar artery, red nucleus, midbrain, periaqueductal gray matter, oculomotor nucleus. Clinical lesions of oculomotor nerve. Damage of oculomotor nerve may occur due to following factors: compression by aneurysm of the posterior communicating artery as it passes between posterior cerebral and superior cerebellar arteries; compression by aneurysm on the internal carotid artery as it passes through lateral wall of the cavernous sinus; compression by transtentorial uncal herniation at it passes through tentorial notch. The damage of oculomotor nerve clinically presents as ptosis, drooping of the upper eyelid, due to paralysis of the levator palpebrae superioris, lateral strabismus, lateral squint, due to paralysis of the medial rectus and consequent unopposed action of the lateral rectus muscle; dilated and fixed pupil, due to paralysis of the sphincter pupillae and consequent unopposed action of the dilator pupillae; Loss of accommodation due to paralysis of the medial rectus sphincter pupillae and ciliaris muscle. Double vision or diplopia occurs on looking medially, inferiorly, and superiorly due to paralysis of the medial rectus, inferior rectus, and inferior oblique muscles. Proptosis, prominence of the eyeball due to relaxation of the muscles of eyeball. Trochlear nerve, fourth cranial nerve, purely motor, supplies only one muscle, superior oblique muscles of eyeball. You can learn it by SO4. SO4. Unique features. Only cranial nerve which emerges on dorsal aspect of brain. Most cylinder of all cranial nerve. Smallest cranial nerve. Nucleus only receives ipsilateral corticonuclear fibers. General function, general somatic efferent 3, 4, 6, 12 supply superior oblique of eyeball. Courses arises from dorsal aspect of midbrain, one on either side of frenulum villi. Passes posterior and superior cerebellar artery, cavernous sinus, enters orbit through superior orbital fissure, superolateral to tendinous ring, runs medial above levator palpebrae superioris, interorbital surface to supply superior oblique. Eyeball, superior oblique, levator palpebrae superioris, superior orbital fissure, posterior cerebral artery, superior cerebellar artery, trochlear nucleus, trochlear nerve, midbrain, periaqueductal gray matter. Lesions of trochlear nerve. The injury of trochlear nerve will cause paralysis of the superior oblique muscles of the eyeball. This will clinically present an extorsion of the eyeball and weakness of downward gaze. As a result, the patient faces difficulty while going downwards or reading newspapers, and diplopia, double vision, which occurs when the patient looks laterally and in glances on looking downwards there is compensatory head tilting to the opposite side. Thank you.